Hi guys, this is Caroline Peregrino, a psychiatric nurse practitioner out of California, and this is my 11th video, and what I want to talk about is telepsychiatry. It's very timely right now because all of us in California, just a few hours ago, they have just told us that the state of California is in total lockdown. We don't know how long that would be, but I think this is a good thing to prevent further transmission and more cases of the COVID virus, but this is something that we have to deal with. And as a psychiatric nurse practitioner, we have to adapt to this really fast for our patients. So recently, in the last week, in the last few days, a lot of things have happened, and I think one of them is, the shelter in place mandate, the social distancing, not allowing patients to come to the clinic who may not really be in a need or emergent situation to come to the clinic to prevent their exposure to the COVID virus. So a lot of posts and questions on social media about this as to what does the new information says, what does this mean for me, and all of that. I mean, personally, I not really done telehealth so much in my private practice, and also in in my anywhere really. I really have not utilized it that much, but now I have to because of this situation. And because of that, the federal government, Medicare, also have made a lot of changes to their rules, and that's what I want to talk about today. So a lot of questions come up whether should I do telehealth with this current situation, and the big answer is yes. Some nurse practitioners were saying, well, should I really do it? I mean, is that selfish to do that because I don't want to expose myself? It's not. You're actually protecting yourself, but also protecting your patients. You do not want your patients coming into the clinic where they expose themselves to so many people, right? I see now that, when a patient comes, you want to sanitize again and then sanitize again, with each patient. And that's pretty tedious. And I think it's a lot better for patients not to come to your clinic and actually do telepsychiatry and do video conferencing. So yes, you should switch to telehealth, during this time. It's a way to protect you and your patients. Flatforms, there's so many different platforms. There's free ones, there's non-free ones, and I'm going to include it in the link. I found it through Simple and Practical. They have a link and a list of all different platforms that's available. The one that I use, and I've just used it last week when I saw a patient, and it actually worked wonderfully. It's called doxy.me, and it's free. Before, when I used it, it's a hit or miss, but so far last week it went fine. There's also another free telepsychiatry that I found, and I forgot the name, so I'm going to put it in the link in the description as well. And it seems to be free, and they said it's free because of the current crisis. So there's a lot of free platforms now out there that seems to be HIPAA compliant because of the current public health emergency crisis. So the president and also the Centers for Medicare and Medicaid Services have made a lot of different announcements and a lot of changes in telepsychiatry so that we can actually have the patient access us healthcare providers a lot easily. It used to be that our license, like for example, like I'm in California, the patients that I'm seeing in telepsychiatry, they have to also be present during the telehealth visit in California for me to be able to see them. So if their residence is in California, but the time of our telehealth visit, they went to Las Vegas, Nevada, I cannot do telehealth with them because I'm not licensed in Nevada. So that was the old rule, but now because of the emergency, that is completely out the window. That is not the rule anymore. So patients who happen to have been displaced to a different state because they moved to a relative because they didn't want to be in a heavy area, just like where we are right now, they moved to a different state to visit a relative, then we can continue to do telehealth and Medicare will pay for it. So two things about that is these are for Medicare patients. I do not know so much about commercial patients so far. I'm going to talk about Cigna because I'm paneled with Cigna and I've got some information from them, but you need to get information from your own insurance provider that you're paneled with as to what is their current rule and regulation in terms of using telehealth services. So that, again, that rule is out the window. It also used to be that in order for Medicare patients to use telehealth, the patient has to be an established patient. So that means you have already seen the patient in person, and then you can do telepsychiatry for the follow-ups. So now that's also loosened and it's waived. So you can now see patients through telehealth even though it's the first time you're seeing the patient. So they don't have to be an established patient. That rule was also strict in regards to prescribing controlled substances. So you really need to make sure that that patient is seen in clinic first, face to face, before you move them to telehealth. But that also is waived. So you can now see patients who are, say, on ADHD medication as a new evaluation through telehealth. Let's see. And also, they said, and I want to quote, for as long as the secretary designation of a public health emergency remains in effect, DEA registered practitioners may issue prescriptions for controlled substances to patients for whom they have not conducted an in-person medical evaluation. So that's their exact wording. So it just means that the patients do not need to be an established patient. We can see them through telehealth as an initial evaluation. Let's see. Also, this is also the other big thing is the HIPAA compliant platform. So there's a lot of patients who may not have access to the technology, or not know how to use Skype, or not know how to use teleconferencing, the platform that we're using that's HIPAA compliant. Now, according to the president and the Medicare services, that's also waived. So the patient can choose whatever platform they want to use. It could be FaceTime, it could be Skype, and they will not audit healthcare providers during this time because of the crisis. So it's giving us a lot more opportunity to give patient access to us so that we can help them fully. So in regards to commercial insurance, I'm going to talk a little bit about Cigna. When Cigna sent me an email saying telehealth is something that they will cover, but we need to still continue to find a HIPAA compliant platform. And they are also acknowledging the state-specific requirements related to the public health crisis. So it's a little bit vague what that means, but that tells me that they would not allow for a Skype or FaceTime, but it would be a HIPAA compliant platform. And also the acknowledging state-specific requirements, my take on that is that they are okay with initial evaluation being telepsychiatry and not have to be established patient, and that we can see patients who are displaced to a different state because of this current crisis. And just to look at it, I think this is all just temporary, and it might change back to where it used to be. So that's pretty much, I think, my understanding of this telepsychiatry that has changed recently in the past few days, and I'm sure we'll see more as new developments happen, right? So I think this gives us a lot of opportunity to help patients nationwide. So I'm hoping that if you have more information about this, specifically on the commercial side of the commercial insurance side, maybe you can put it in the comment section so we can get more information. I'm also going to put in the description section the platforms, the website. Simple and Practical actually has a lot of information in regards to this. They actually did an interview with a practitioner who is very well known in doing telepsychiatry, or I think he's also an MD, and you can get a lot of information through him. So if you don't have Simple and Practical yet, I really urge you to use that, because it's a little tidbit of information that you can get about medications, about treatment in psychiatry, and it's I pay a monthly fee of $14.99, and I think it's totally worth it. So look it up, and I'll put it in the description. So I'll leave it at that, guys. You guys be safe. Really do social distancing, because whatever we're doing right now, it's not gonna work if one of us ruins it for all of us, right? So please do us a favor and take care of yourself and follow the rules. Okay, take care, guys. Be safe. Bye.